will tell you about the anatomy of spinal nerves. Spinal nerves is a part of peripheral nervous system. They are mixed nerve that send motor, sensory and autonomic signals between central nervous system and the body. Humans have 31 pairs of spinal nerve on left and right side of the body. About its location. Each spinal nerve is formed by combination of dorsal and ventral roots from the spinal cord. The dorsal roots carry afferent sensory axon, while the ventral roots carry efferent motor axons. The dorsal roots are sensory in nature, the ventral roots are motor in nature. The spinal nerve emerges from the spinal column through an opening between the adjacent vertebra. That opening is called an intervertebral foramen. In this picture, you can see this is the spinal nerve. It comes out of through an opening called the intervertebral foramen. This slide will tell you about the structure of an ideal spinal nerve. This is this cross section of spinal cord, and from here we can have the ventral root. This is the dorsal portion or posterior portion, and here we can have the ventral root, and this is the anterior portion of the spinal cord. So ventral root originate, and this is motor, and the dorsal root originate from the dorsal side, and that is sensory. Dorsal root have a ganglion. Then the dorsal and ventral root join together and form what we call exactly the spinal nerve. After running a short distance in union, it divides again into different branches. The dorsal ramus, the ventral ramus, the white ramus and the grey ramus. The dorsal ramus carry sensory information from the dorsal part of the body towards the spinal cord, and it will provide or supply motor innervation to the dorsal aspect of the body. The ventral ramus carry sensory information from the anterior part of the body to the spinal cord, and it supply motor innervation to the ventral part of the body or to the anterior part of the body. White ramus and grey ramus are autonomic in nature and they supply visceral organs. This structure can be compared to a tree. A tree has a root, trunk and branches. Similar to the roots of the tree, the spinal cord roots are dorsal root and ventral root. About the trunk of the tree can be compared to the spinal nerve, the body of spinal nerve. Then again, the branches of the tree can be compared to different rami of the spinal nerve, dorsal ramus, ventral ramus, white ramus and grey ramus. So remember, the spinal nerve can be compared to the structure of a tree. Then, the spinal nerve only exists for a short distance. The trunk of the spinal nerve is only for a short distance. Then they diverge into ventral and dorsal branches called the ramus. Dorsal ramus contain sensory and motor innervation to the back, and ventral ramus supplies ventrolateral part of the body and the limbs. Rami communicates, that is, the grey matter and grey rami and white ramus and together called Rami communicates. They contain sympathetic nerve branches. Each pair of spinal nerve that supply a particular part of the skin, and that is called a dermatome. The spinal nerve supply sensory and motor. Then the spinal nerve that supply a particular region of the skin, and that is called a dermatome, which include its sensory supply. In this image, you can see the further details about the structure of spinal nerve. Dorsal root, ventral root. Dorsal root have a ganglion that is called a dorsal root ganglion. Then it run for a short distance in union, that is the spinal nerve, the body or the stem of the spinal nerve. After that, it diverges into ventral ramus and dorsal ramus. Both contain sensory and motor innervations or nerve fibers. Then also we have short branches called the grey ramus and the white ramus. They together are called rami communicants. Since the ventral ramus is motor in nature, it consists of two types of fibers, visceral motor fibers and somatic motor fibers, which originate from different parts of the grey matter of the spinal cord. About the visceral nerve fibers, it starts from visceral motor nucleus or area in the spinal cord. Then it enters the spinal nerve and then it comes to white ramus, where we call it as preganglionic, or it contains preganglionic fibers because it is myelinated. It ends in a sympathetic ganglion. From there, it continues to supply preganglionic fibers to sympathetic ganglia of the abdominal pelvic viscera through a sympathetic nerve. Then, from the sympathetic ganglion, the postganglionic fibers originate, and that is also the part of spinal nerve, and it supplies postganglionic fibers to smooth muscle, glands, and visceral organs in the thoracic cavity. Again, this visceral motor ends in the sympathetic ganglion. From there, another branch originates and it enters into grey ramus. Again, it goes to spinal nerve and divides into two, supplying postganglionic fibers to smooth muscle, glands of body wall and limbs, and also to supply postganglionic fibers to smooth muscles and glands of the back. From the somatic nucleus, the somatic motor fibers emerge and it enters the spinal nerve and divides in the spinal nerve and directly enter into ventral rami and dorsal rami. The dorsal rami fibers supply to skeletal muscles of the back, and the ventral rami supply motor fibers to skeletal muscles of anterior part and the upper and lower limbs. This is about the origin distribution of spinal nerve throughout the body. Next, about dermatome. We have seen already there is a specific pattern to show or how the nerves carry sensory information from our skin to our brain. Each spinal nerve carries sensory information from specific region of the skin, and that particular region is called a dermatome. Here, the differently colored portions are called a dermatome. This is a dermatome. This is another dermatome. This is supplied by C3, C4 spinal nerve, and this is supplied by the spinal nerve from C5, C6, and similarly the different colored area is called a dermatome. Then similarly, a spinal nerve supply a specific group of muscles and that is called a myotome. Dermatome and myotome testing is an integral part of neurological examination. In this image, you can see different types of spinal nerve. Here you can see cervical vertebra. So, cervical vertebra are 7 in number, but there are 8 spinal nerves, cervical spinal nerve. The spinal nerve that originates from cervical vertebra is called the cervical spinal nerve, and they are 8 in number. These colored structures are spinal nerve, cervical spinal nerve. And here you can see somewhat cream colored or dark cream colored spinal nerve, that is from T1 to T12. They are called thoracic spinal nerve or thoracic nerve. They are 12 in number. The blue colored nerves are called lumbar nerve. They are 5 in number. And S1 to S5, there is another 5 pairs of nerve and they are called sacral nerves. C8 or cervical nerves 8, thoracic 12, lumbar and sacral 5 each. And there is another single set of nerve that originate from coccyx. That is called a coccygeal nerve. So altogether there are 31 pairs of spinal nerve. C8, T12, L5, S5 and coccygeal 1. Altogether 35. Here this is the anterior image and this is the posterior image. Anterior portion you can see different colored area. Each colored area supplies different types of spinal nerve according to the nerve area of origin from the spinal cord. This area, that is, it represents the cervical part, the cervical nerve. This color represents the cervical part. Here you can see cervical vertebra supply or cervical nerve supply, head, the lower portion of the head, neck, shoulders, the lateral aspect of the upper limb and the hand anteriorly. And posteriorly you can see the posterior part of the head, neck, shoulders and the posterior entire part of the upper limb. This is the area supplied by cervical nerves. Then coming to here, the thoracic nerves, they supply thoracic vertebra or intercostal muscles. They supply the intercostal muscles of the front and the back and also some of the abdominal organ, upper abdominal organs. Then this color represents the lumbar nerve supply. They supply the organs of the pelvic region, the anterior part of the lower leg and the posterior part of the leg including thighs, hip region, thighs, calf and the lateral aspect of the feet. And the genital part is supplied by sacral nerves, specifically S2 and S3. So remember, there are 31 pairs of spinal nerve C5, 8, T12, L5, S5 and coccygeal part. And remember the area, the body part supplied by each set of spinal nerves. Now coming to nerve plexus. The spinal nerves from T2 to T12 are simple. They supply the skin and the muscles in the back and the thoracic abdominal pelvic region via dorsal and ventral rami. The spinal nerves from or thoracic nerves supply the skin, the sensory part supply the skin of the anterior and posterior region, the muscles of anterior and posterior region, and also the skin of thoracic and abdominal pelvic region through dorsal and ventral rami. Other spinal nerves, they form a network and that network is called plexi in plural and plexus in singular. Except thoracic nerve, all other nerves from different region of the vertebral column form network of nerves called plexi or singular plexus. About further details of nerve plexus. There are 4 nerve plexus thereby except thoracic nerves: cervical plexus, brachial plexus, lumbar plexus and sacral plexus. The cervical plexus supply head, neck and shoulders. Brachial plexus supply chest, shoulders, arms and hands. Lumbar plexus supply back, abdomen, groin, thighs, knees and calves. Sacral plexus supply pelvis, buttocks, genitals, thighs, calves and feet. The thoracic nerves, they will not form any plexus. They supply to each intercostal muscle. There are 12 pairs of spinal nerve and there are 12 12 ribs. So they supply, each thoracic nerve supply to each ribs. Here you can see the cervical plexus formed by upper cervical vertebra, brachial plexus formed by lower cervical vertebra and upper lumbar vertebra, that is T1. Then there is no plexus from thoracic nerves. It supply intercostal muscles or they form intercostal nerves. Then the lumbar plexus you can see from lumbar nerves and sacral plexus from sacral nerves, and the coccygeal nerve exists as one single nerve. About the cervical plexus, they are formed from first to fifth cervical vertebra. They are formed from or they originate from first to fifth cervical vertebra. The major nerves that originate from this plexus are lesser occipital, greater auricular, transverse cutaneous, supraclavicular, and the most important one is phrenic nerve, which control the diaphragm. Altogether, these cervical plexus innervate muscles and skins of the neck. The important nerves are this one, with each occipital, with each nerve supplying different parts of the body. In general, they innervate muscles and skin of the neck. About brachial plexus. Brachial plexus are formed from lower cervical and upper thoracic vertebra. So the lower thoracic starts from lower cervical starts from C5 and the upper thoracic is only T1. So cervical plexus are brachial plexus are formed from C5 to T1 vertebra. They form three trunk. The spinal nerves from C5 and C6 form the superior trunk. The spinal nerve from C7 form the middle trunk, and from C8 and T1 spinal nerves form the inferior trunk. In this image, you can see the superior trunk, middle trunk, and the inferior trunk simply. From each trunk, there is anterior and posterior division, which further provide different cords. The important nerves from brachial plexus include musculocutaneous nerve, median nerve, ulnar nerve, radial nerve, and axillary nerve. In this image, you can see the different area of the body supplied by these nerves from brachial plexus. The musculocutaneous nerve supply flexor muscles in anterior aspect of the arm and the skin on the anterior lateral forearm. The median nerve supply anterior forearm and palm. Ulnar nerve supply forearm and intrinsic muscles of the hand. Radial nerve supply posterior muscles of the arm, forearm and hand. Axillary nerve supply deltoid and teres minor muscles. Here you can see the median nerve, the ulnar nerve go through the ulnar side, the median nerve in between, and the radial nerve go through the radial side of the arm. In general, brachial plexus supply both the upper extremities and the axillary area. About lumbar plexus. It is a network of nerves formed from T12 to L4. They supply lower abdominal pelvic area and lower limbs in general. The very important nerve or the major nerve is femoral nerve, which originates from L2 to L4. And it has two branches, anterior femoral cutaneous branch and a saphenous branch. The saphenous branch supplies the skin on medial aspect of the leg and foot. The anterior femoral cutaneous branch supply anterior and medial thigh, especially quadriceps and the sartorius muscle, its motor function. Here you can see femoral nerve along with the other less important nerve. They are important, but they are not as major as compared to the femoral nerve. You can see the nerves like intercostal nerve, iliohypogastric nerve, ilioinguinal nerve, genitofemoral nerve, lateral femoral cutaneous nerve, and this is the major nerve femoral nerve, obturator nerve, and a lumbosacral trunk. These are the set of peripheral nerves that originate from lumbar plexus. Most importantly, remember the name femoral nerve. Other nerves we have already seen, obturator nerve and a lateral femoral nerve, less major nerve compared to femoral nerve. And the last plexus is called a sacral plexus, that is from L4 to S4. It supplies buttocks, posterior thigh, lower leg and foot. The major nerve is sciatic nerve, which is important while giving the injections in the dorsogluteal site. If we do not identify this site correctly, it may damage this nerve, resulting in paralysis of the lower extremity. It originates from L4, L5 and S1, S3. It diverges into tibial nerve and a common fibular nerve proximal to the knee joint. This is the sciatic nerve. And other less important nerve or less major nerve or minor nerves are pudendal nerve, posterior femoral cutaneous nerve, inferior gluteal nerve, superior gluteal nerve, and lumbosacral trunk. Other important nerves. Already we saw posterior femoral cutaneous nerve, superior gluteal, inferior gluteal. Here you can see the pudendal nerve. Thus we have come to the end of this video. Remember, the spinal nerve can be compared to the structure of a tree. We know a tree has roots, stem and branches. Similarly, a spinal nerve has root, ventral and dorsal, a short body or stem, and then it diverges into mainly dorsal ramus and ventral ramus and also into rami communicants, which include grey and white rami. Thanks for watching. Please subscribe and share.